So going back to our company, over the next few years, we dipped under the radar and just minded our own business and got on with trying to understand this technology. So we worked closely with our Georgian, French and US colleagues, gained a good grounding in the Phage technology, began to build our own local Phage collection, and established links with Phage groups all around the world. And then we also, at the same time, were trying to link up with industry sectors because our name was Special Phage Services, and that was deliberate because we saw ourselves as an enabling technology, providing solutions to industry sectors that were having trouble with antibiotics. And we set up a number of joint projects and joint ventures with these industries. And we're now proceeding with trials planned for next year onwards in the veterinary, poultry and other industries. Perceived wisdom, one of the reasons why we kept in those industries rather than human health was the perceived wisdom at that stage was that it would be decades before phages would ever be permitted to be used in humans in the Western scenario. But if you think what's happened in 2007, in a very short space of time, omnilytics, intralytics, EBI have all announced successful registration and launched modern Phage products on the market. So this really was much faster than anybody anticipated. And of course, as a little Phage company in the industry, we cheered them to the rooftops because that was a major milestone for this industry. And then the safety issues that everyone asked about. Harold Brusso of Nestle published the first modern safety trial in human volunteers, demonstrating unequivocal safety of E. coli phages. More cheering. And then again, at the Pasteur meeting the Pasteur meeting, clinics in France, Germany and Belgium described successful treatment of patients openly, again for the first time in the Western scenario. So lots more cheering, and suddenly this clinical application of phage therapy to humans, instead of being in the dim distant future, was suddenly getting very close and looked very practical. So we were very interested and pleased with that. We didn't anticipate clinical treatment at this stage of our development, but part of the proof of principle that we've been doing was on MRSA and MRPA, multi-resistant Pseudomonas aeruginosa isolates from the hospitals in Sydney. And we've started to get increasing compassionate use requests coming in from this large, unseen population of people with resistant infections. And so in a way we were overtaken by events. We received a direct approach from one of the major teaching hospitals for assistance to help with a patient. The small company, of course, we had to take the utmost care because we're not permitted to actually carry out phage therapy. But so we got patient ethics committee, state, federal regulatory approval was all requested and received and processed through the hospital side. And we then helped the hospital develop a particular phage cocktail for the patient. I want to talk about just 4 cases which are typical of many requests that we're getting. So these are 4 different cases where they get an idea of what's happening out there. Only 2 of the cases actually underwent phage therapy. The first one, which you can see in the poster out in the poster room, was a 60-year-old female patient who had a multi-resistant Pseudomonas bladder infection, and she was faced with the choice of either radical surgery or trying this new treatment. And we collaborated very closely with the Eliava, with the Eliava Institute. We tried out their cocktails, and then we sent the isolates backwards and forwards between Georgia and Sydney until we got almost a patient-specific cocktail, and then the patient was treated by catheter over a period of time. But you can read the details about it, but in fact the result was the infection was cleared, no recolonization observed 6 months post-treatment, and she's been going back every month for testing. But the encouraging thing about this to me was this lady was in the hospital a week before Christmas and was looking forward, or not looking forward, to a rather miserable Christmas. By Christmas, she was out of the hospital and home And within 2 or 3 days, she was feeling wonderful. So, you know, you can talk about placebo effects, but we were following the phage very closely, we were following the bacteria very closely, and obviously she was feeling much better. The next, following that, we were then asked to help another patient, which we call P2, another 6-year-old female who was suffering from extensive surgical wound infections and fat necrosis, and she'd been heavily colonized with another MRPA, the Pseudomonas. This spilled over into the bloodstream, so she actually started to go downhill very fast. So we were asked by the hospital at very short notice to try and produce a phage treatment. And we went ahead, and this time none of the phages in the Eliava cocktail worked. So we started from scratch from our collection, and we developed very quickly developed a protocol and a cocktail for this lady. And you can see here, this is the Pseudomonas, and this is the Pseudomonas plus the phage in our workup towards the treatment. But in fact, they managed to stabilize her infection, her bloodstream infection, and we haven't proceeded with treatment. But the hospitals asked us to hold this phage because they are not sure whether she'll have a recurrence. So that's another case. This is the third case, and this is again different because this is also happening out there, as Reza Dalia mentioned. This is a 35-year-old male, former bodybuilder, very fit, with chronic sinusitis. Previously very healthy, but he got this FRSA infection and developed chronic sinusitis, multiple infections, multiple ENT interventions, high doses of antibiotic. He started to see sort of pancreatitis associated with the antibiotic side effects, and came to us, and we said, well, we don't have any experience of sinusitis, and we can't treat you, and there's nobody here that really knows how to do it. So after some discussion, we linked up with another clinic and another organization called Phage International, who operate with the Eliava. And so the patient traveled to Georgia. He had a detailed workup, and all the different flora and isolates were tested. They made a phage cocktail, and they used phage therapy and immunotherapy on him for 2 or 3 weeks, so he stayed in Tbilisi, and the treatment was highly successful. Now, we've told him, the Eliava clinical staff have told him that it's not a cure, because with his underlying condition, sinusitis is bound to get this back. But he told us when he came back that he hadn't felt as good as that since he was 10 years old. This is the fourth one, and this is a very troublesome one to us, but it's typical. 9-year-old boy with cystic fibrosis. He has a recurrent staph infection, and the staph isolate, you can see here, is highly susceptible to phages in vitro, but his lung function is deteriorating, and he's falling below the normal weight gain patterns, very high doses of antibiotics, and his parents have come to us, and they're absolutely determined to use phage therapy. We obviously can't interfere, but they're determined to, so they may either go to Tbilisi or they may try and do it themselves. So that to us was quite interesting, these 4 cases, because they're indicative of this constant barrage of people coming through looking for help.